But until then, let's continue with Dr. Gary Kirsh. September is National Prostate Month. A supple prostate is a happy prostate. Dr. Gary Kirsh, welcome again to the Bill Cunningham Show.
Thank you, Bill. It's a great pleasure to be back.
Can I tell you my last prostate exam with your good friend and mine, Dr. Cordell?
I know you had one. I don't remember the details. Please proceed with those.
About 2 months before June 30th, he got a hold of me through his secretary or nurse and said, Dr. Cordell would like to extend to you the honor of being his final patient.
Oh.
And I said, well, I'm not due to come in until December, but, how can I turn that down? I play golf with him at Western Hills Country Club, 2-man. I've had him over to Kenwood. Diane, Penny, me, and Alan spend time together in Naples. So I said, hey, how many years? About 38 years as a urologist. I said, well, I'm honored. I guess I'm honored. Should I have felt honored?
I think whenever Dr. Cordell's finger is involved, you should feel honored.
So I said, well, what's the date again? June 30th. What time? 4:45. So we're having something for him in the office at 5:30, and we're going out to dinner afterwards. I said, okay, sounds good. So I worked my way over to that brand new hospital. I forget the name. You go up to the right there, take another right. It's over there.
Mercy West.
That's where it is. So a nice place. I walk in. There's nobody there. I mean, it's a big waiting room, and, the nurses, secretaries, everybody's around. And they said, well, welcome, Bill. Fill out some more stuff. And he said, go into examining room 3. So I go into examining room 3. There's still, no patients, hardly anybody there. So I sit there about 5 minutes and said, well, Dr. Alan Cordell, I'd like to see you in examining room 7. So I said, well, okay. I get up, walk down, and she opens the door. I walk in, and she shuts the door behind me. There in the corner of the room is Dr. Alan Cordell, sitting in a chair. In front of him is a table with 2 glasses of Chardonnay, a rose, and another chair. He said, Bill, have a seat. And at this point, it's dark, and the candle's burning, and it was, a little flickering light. And he spoke about his days in Kentucky, UK. He spoke about golf. He spoke about his love for his wife and his kids. And he said, I've gone through all this, and I just hate the 4 a.m. telephone calls, 2 a.m. telephone calls. Got this, got that. And the insurance companies and Obamacare, and it's just, the licensing requirements anymore. 38 years. I said, Alan, 38 years is enough. He poured me a glass of wine, and we sat there for 15 minutes and enjoyed a glass of wine together. Now, how romantic is that?
That's beautiful. I just hope that the exam didn't come along with the wine.
Well, and then what happened next is that a couple of nurses came in applauding, and they took pictures of us sitting there at the tables together, and then they left the room. And he said, it's time for the exam. And I said, this is going to be great. So he slips on the gloves. I bend over the wall there, and he does a nice long prostate exam. And those were moments that can never be duplicated. Would you agree?
You'll cherish those the rest of your life.
I got a great picture of that. And then after that, he almost had a tear in his eye. He said, that's it, I'm done. I said, Doctor, I'm glad that my prostate was the last one you felt. Should I have been honored? I was honored. I mean, I felt good about that, wouldn't you?
Well, I think you should be honored, and in fact, you've got me thinking, I wonder who my last prostate exam will be on.
How many more years do you have?
Well, I'm 57, so it just depends on what the government does to me between now and then, but probably another 6, 8, 10.
Yeah, at some point you can't wait. I think Alan's probably about 64, 65, I would think.
I think he might be slightly north of that.
Well, he seems younger, but, at some point, as an older doc, and I talked to some other, like Dr. Mike Mader, my Jeep, he's an internist.
Sure.
I got a nice letter from him saying I'm done. He said December or whatever. In fact, his last day in Hyde Park internist is December the 11th, which is my birthday. So he got a hold of me and said, could you come in on December the 11th, which will be my last patient? I said, I don't know if I like the way this is going. I said, but I'll do it. I'll come in on December the 11th.
You're providing quite a service for these doctors who are going out.
I don't know, but what's happening in the medical profession? So when docs get to be 55, 65, normally you kind of slowly wind it down, but now it's like a brick wall. They're done. Can't do it.
Yeah, we're seeing more and more of that, Willie. We really are. That between, as you said earlier, all the changes in medicine really make it rougher for the older guys, whether it's the electronic record and the insurance requirements, the recertification. I mean, you got to take these big exams even when you're in your 60s. It gets to be a little rough, so people are just kind of dropping out.
And isn't experience more important than education?
Well, it's
got to have both.
Absolutely. I'll tell you what, we have to take these exams every 10 years that you got to go back and hit the books like you were in college. And, you don't need to do that. You need to know how to do a rectal exam or take a kidney stone out, which you've been doing for 35 years. So it's just becoming more and more onerous, and I think that's not just in medicine. I think we see that across all industries with all the regulation.
Who's making you do that? Is it the government?
Well, it's indirectly, I guess. It's there's something called the Board of Medical Specialties, and they kind of control board certification across all specialties. And when I went and practiced in 1989, it was a lot easier. Now, at that time, I was one of the first doctors to finish their training where you had to even recertify. It used to be that you only had to get certified once. When I finished, you had to get recertified every 10 years. Now they make you do something every 2 years.
Oh, my gosh. Because when I took the bar exam in 1975, I finished fourth in the state. Of the thousands taking the bar exam, I was number 4. And if somebody asked me to take a bar exam now, I would flunk it. I'd have no chance of passing a bar exam. None.
Well, that's what we're facing.
All right, let's talk about, this is National Prostate Month. What does that mean, Dr. Gary Kirsh? What does that mean?
Well, it means we're trying to raise awareness for prostate cancer, of course, and to put in a shameless plug, we're having our annual prostate cancer run here in Norwood at the Urology Center coming up in about a week. The date would be Saturday the 12th. And you can register on urologygroup.com. And last year, I think we had about 2,000 people come out with some local dignitaries. We're raising money for an organization called ZERO, which is a nonprofit benefiting prostate cancer research. So this is Prostate Cancer Awareness Month. We want people to come to our run. We want people to get checked. We don't want people to think prostate cancer is a nothing disease, because as you remember, It's the number 2 killer of men after lung cancer.
I had a good friend of mine who talks about it a couple of times on the air, and he tells everybody, Wayne Carucci, who's one of the best guys I know, had a PSA of 55, and then had it redone because it was obviously a mistake, and the PSA came back 53. And he, of course, had cancer, and the tumor got outside the prostate, and he's been fighting it for about 10 years. And it's tough. And if you catch it early, it's very curable. If you catch it late, then you got major problems. And a PSA, Cordell told me my prostate was a little bit enlarged, but it was looking good. And my PSA came back 3.2.
Perfect.
And I talked to another doc there, and he said that's about, for a 67-year-old male, 3.2 is pretty good. It got as low as 2.4 and as high as 3.6. So it's kind of in the area there. That's okay, right?
Oh, beautiful. Yeah, you got a beautiful PSA, and I understand you have a beautiful prostate. It's well known around our group.
Well, the fact of the matter is, this is something I should say, but you have a good female urologist there. I forget her name. And Cordell said to me, would you like to go to a female urologist? And I said, oh, not really. But he said, she's only like 35, been out about 3 years. She's sharp as a tack, and she knows everything about it. But I'd have a hard time going to a female urologist. You know what I'm saying?
Well, I do, but Bill, it's the times, the wave of the future. In urology training now in the residency programs, I don't know if I can be quoted on this, but I bet 25-30% or more of the urology residency candidates now are women.
And they're better people than men. The best people I've ever met in my life are women. They're not men.
Well, of course, they're more gentle, more empathetic, and more intelligent.
Well, they're brighter, I know that, and they have more feelings. Maybe I'll give her one shot, but I just wouldn't feel right.
Well, that's Dr. Rodersheimer.
That's it, right there.
Yeah, she's very qualified. And of course, if you're not satisfied with that suggestion,
well, I mean,
I got 35 or 40 others I can send you to.
I like a skinny male.
I'm not too heavy, and my hands aren't too big, so I'd be.
I'd rather come to you, Doc.
It'd be an honor to have you bend over, Willie.
I couldn't trust a woman in front of me naked. I couldn't trust her. You know what I'm saying?
I do.
Well, now, as far as the prostate, for men in general, you talk about the run. isn't it important to be in generally good health no matter what's happening, but especially for your prostate?
Well, in fact, it is, because prostate cancer has been linked, like everything else, to the Western high-fat diet. And so the more you cut back on a lot of those animal fats and snack fats, and the healthier you are, there's some link to obesity as well. So the healthier you are in general, it actually decreases your risk of prostate cancer.
At what age should a man start having his prostate examined and getting a PSA?
About 50, unless they have a family history or they're African American, in which case a baseline really should be done earlier, 40, 45, just to get a baseline.
So why are black guys getting it earlier than white guys or Asian guys?
Well, I don't think anyone knows for sure. There's a genetic predilection in the African American community to that disease, prostate cancer. And as you know, there are many diseases which happen to be more common in one population or ethnic group than another, and prostate cancer just happens to be the one for the African American community. They also have a higher incidence of hypertension and other diseases in the African American community, and then you can go around the world to other communities and find other problems. So it's just a genetic thing.
Now, I have a buddy of mine that went out to Loma Linda for the specialized deal. I forget what it was, but it wasn't like the whole deal, take out the prostate, which has these side effects. You know what I'm talking about, the Loma Linda deal?
I do. The Loma Linda deal is called proton beam.
That's it.
Yeah. That Willie has become a little more controversial since then. In fact, they had a unit in Indiana, Bloomington, and it went out of business.
Why?
I don't know. The proton treatment is very expensive. It's a couple $100,000 to the government or to the insurance company, and it really hasn't. It's not a bad treatment, don't get me wrong, but it really hasn't panned out to be so much better than anything else to justify the cost.
What are the other things like the seeds? And if a guy doesn't want to have his prostate taken out because of the side effects, how good are those seeds?
Well, the seeds are good. We've been doing seeds for 20-some years. We've done more of them than anybody in several states around here. But, you know, I also don't mind putting a plug in for our new technology, which we think goes beyond the seeds, and that's called Cyberknife.
Oh, my.
And we may have spoken about that before.
I think you might have. Yeah, what is the Cyberknife? That sounds pretty fancy.
It's a non-invasive treatment that involves 5 treatment sessions, unlike other radiation approaches that could involve up to 40 or 45 daily sessions. It involves 5 sessions, and it's got increased precision compared to standard radiation. It doesn't necessarily have increased precision compared to the seeds, but it has a little less side effects than the seeds.
So the Cyberknife Urology Group, what you do there, it's 5 times, and all you do is fight the cancer until you die of something else.
Well, we try to cure the cancer, so you never have to worry about it again. And, of course, some people don't have radiation. We still do a lot of prostate cancer surgery with robotic surgery, and it's a little complicated as to, who will get which treatment. Depends a bit on the person. But I would say our main treatments are some people who require the robotic surgery, which is less invasive than surgery used to be. And then if we can, and we don't have to do that, we would like to use that Cyberknife because it's really the least invasive of the radiation options.
Do you keep your Uncle Woody if you do the Cyberknife?
Well, you have a better chance of keeping it than you do with surgery. Yes, sir.
All right. Do you have any questions for me about geomorphology, politics, world capitals, sports, something that's confused you over the years?
Well, I am confused about what the Bengals are going to do this year, Willie. I've seen a lot of inconsistency in training camp, and I'd like to know whether I should be interested in them this year or not.
On paper, windows open and windows shut in sports. Normally the window's 3 to 4 years. The Reds' window opened in 2010, and it closed in 2013. The Bengals have an open window right now, and they're in their the last 3 or 4. 3 or 4 years they've gone to the playoffs and lost every time. The window's about to close. They have this year and next year, then the window is shut. Is this team marching in the shoes of Chris Collinsworth and Ken Anderson, or are they marching in the shoes of Bengals failures of the past? Because this season they're playing a tough West Coast schedule. They play the NFC and the NFC West. And because the Bengals do so poorly on the West Coast, I think they're going to have a problem this year. But the difficulty is the Steelers and the Ravens also play essentially the same schedule. But the problem is the Steelers play the Patriots in the first game in New England, which they should lose. But all of a sudden, Tom Brady may not play anyway. So I always have faith and confidence that the Bengals might do something. But since 1968, they've been to the Super Bowl twice and lost in both games. They've never done it. The Redlegs have not been to the playoffs and win a series since 1995. And they're not won an LCS since 1990, which is 25 years, a quarter of a century. So if you take the Bengals and the Reds, they have had really failures at least for the last 50 seasons, which is a long time. Hope springs eternal. But here in Cincinnati, Doctor, we're always optimistic. I love the fact that John Barrett lives here and that Carl Linder lived here. We're a special place. We get the best tournaments. We're going to have the best fireworks on Sunday night. We have the best symphony because of the contributions of Louise Nippert. We have all the amenities of a large city with the feel of a small town. Despite the failures relatively of our sports teams, there's no place in the world I'd rather live than right here in Cincinnati.
Well, I agree with you, and I think the Bengals do have a window this year, and I'm going to be optimistic.
I will come see you at the end of the year, and we'll talk in January or February.
We'll have the wine on ice.
Dr. Gary Kirsh, you're a great American.
Thank you, sir.
God bless America.